This press conference is designed to be very comprehensive and give a detailed update about the COVID-19, not only from me, but various leaders within our community. And I want everyone to remember the top three things I continue to share with this community. One is to practice good common sense. If you're sick, stay home. The second thing is great hygiene. Please continue to wash your hands. Please continue to do other things of protecting where you put your hands. And then the third thing is intentional social distancing. I want to thank everyone for following the guidelines of County Health Officer Dr. Mark Wilson and following the order of limiting gatherings to under 25 people and practicing social distancing of 6 feet or more. The efforts that have been put in place should not be taken lightly. This order has been made to prevent the spread of COVID-19. You will hear from several in the next few minutes and understand why we're following the order put in place by the Jefferson County Health Department and supported by the state health officer. I am pleased to announce the City Council yesterday approved our recommendation of more funding to respond to the COVID-19 crisis, and I want to publicly thank them. Our city is committed to providing basic services during this pandemic, and the approval of these funds will allow us to move swiftly in addressing these issues. At this time, I would like to ask Councilor President William Parker to come forth and give a brief update.
Thank you, Mr. Mayor. I just want to concur on our teamwork on yesterday with passing the sweeping funding recommendations that you made. I want to thank all of my colleagues from Birmingham City Council, and we're here to work with you and work with our other stakeholders to make sure we provide service to our residents throughout the city of Birmingham. So, Mr. Mayor, thank you.
The funds approved last night include more than $500,000 to purchase personal protective equipment for our police, our fire and rescue service, and public works. It will also provide funding for our first responders who serve our residents and public works, who keep our facilities clean for employees and the public. Birmingham Fire and Rescue Service Chief Corey Moon will now come forth to give a public safety briefing and update for our citizens and residents of Birmingham. Chief Moon.
Thank you, Mayor. I'd also like to thank the Mayor and the Council for their leadership in providing us the funding that we need to get the equipment to run these COVID-19 response calls. I want the public and everyone that hear my voice, I want you to know that Birmingham Fire and Rescue is prepared to respond. We're auditing and ordering more PPE and supplies for our COVID-19 response. We're also reevaluating and revising our incident action plan as needed. We're currently working with other departments around the state to make sure we're all on the same page and taking care and making sure we keep our citizens and our personnel safe. Lastly, we're also strategically placing equipment and personnel to make sure we have efficient and effective response to these calls. I'd also like to remind everyone, please make sure you're continuing the hand hygiene, make sure you're continuing the social distancing, and please make sure you stay safe. Thank you.
Thank you, Chief Moon. Now, I know many people have looked at this as a public health crisis, and it is. But this public health crisis has also created a local economic possible crisis for our city as it relates to our small businesses, our small business owners, and those hourly workers who work at these establishments. I know many of our small business owners and hourly workers are worried right now. You face economic decisions at an anxious time in the city. And we're committed to working with you and supporting you. And so as part of our COVID-19 response, we created a fund that put $1.2 million in the Birmingham Strong Fund. This is designed to provide zero interest for 180-day loans to small businesses to assist in preventing staff reductions and offset losses related to the coronavirus. We'll take additional steps to launch this fund next week with the Birmingham City Council, but you can learn more about the program at bhamstrong.com. Again, that's bhamstrong.com. At this time, I think it's important to bring Dr. Josh Carpenter up of the Department of Innovation and Economic Opportunity to provide a little more detail on how in the city and what we're doing to work and support our small business owners and how we're engaging our hourly workers as well. Dr. Carpenter?
Small businesses are the lifeblood of our economy, they are the backbone of our community, and they are the pride of our neighborhoods. In Birmingham, we have 5,997 small businesses that employ 47,000 workers. We know that COVID-19 has put many of them under siege. And so what we've done with the City Council, our partners at the Birmingham Business Resource Center and the Community Foundation is to inject funding. Right now it's $1.2 million from the public sector, the city, but we're hoping to raise an additional $1.2 million to provide $2.4 million of potential loans to small businesses. That's businesses with less than 50 employees. Our goal is to make sure that we help businesses who were doing well before this crisis hit our community, to make sure that they can be sustained and that they can keep workers employed and keep businesses moving forward. We are grateful for all the small businesses who are continuing to endure with us, who are patiently working through this uncertainty, and we are going to do everything in our power to make sure that we take care not just of small businesses, but of their workers. In the days ahead, we'll announce more information, not just about this loan fund, but about opportunities for workers who have lost their jobs. Hear me clearly. If you are a small business who is trying to understand how this may affect your business, go to BeHamstrong.com and tell us about it. We will work with you, not just for our program, but for potentially the SBA loan program as well. Additionally, if you're an individual who has lost your job or lost income because of COVID-19, please go to BeHamstrong.com and fill out our survey so that we can help find jobs and opportunities to match you with job opportunities. Thank you.
Thank you, Dr. Carpenter. As I've stated earlier, this is a comprehensive press update. And so now I want you all to hear from Dr. Lisa Herring, the superintendent of Birmingham City Schools, who we stayed in close contact with as they've had to close schools but maintain their important lunch program. At this time, Dr. Herring.
Thank you, Mayor Woodfin. To all of our families, students, all stakeholders for Birmingham City Schools, we thank you for your patience and your support during this time. As you know, Birmingham City Schools has officially closed. However, we have not closed our opportunity to feed our families. Since the beginning of this week, we have provided grab-and-go bags for families at every school site in Birmingham City Schools. That window has been from 10:30 to 1. Effective tomorrow, that will continue, but it will be an expanded meal that is inclusive of a lunch, a full sandwich, in addition to snacks and other essential items. Those will be available at our school sites between now and Friday, March 27th, which is the end of spring break. That time frame still continues from 10:30 a.m. to 1 p.m. It is important that you know that all of our surrounding Jefferson County school systems have made an effort to help nurture and nourish our families. To that end, Birmingham City Schools families and any of the following districts can go to any of the other district sites: Jefferson County, Bessemer, Fairfield, Midfield, Tarrant, and Birmingham City Schools. Those feeding sites will entertain and honor anyone 18 years and younger for feeding. There is no question to that. Just simply show up and feeding will be made available. Those time frames may differ, and it will be our intent to make sure we keep that information in front of you. We recognize the importance of feeding our families during this time. And finally, we understand in Birmingham City Schools, because our schools are currently closed, we want to continue to empower families to have resources to enrich and educate our students. We are not grading during this time, but our system will continue to provide resources for all of our families to help educate and encourage our students during their time away from school. Please continue to connect with our website, our social media, and any other resources that you deem appropriate to help in your child's instruction. We thank you for your patience, and we wish everyone well.
Thank you, Superintendent Dr. Herring. I've also instructed my team to stay in close contact with those populations who are vulnerable due to economic losses or no places to stay. The largest housing provider for hourly employees in our city is the Housing Authority of the Birmingham District, and they've assured me no one will be evicted during this crisis. I've also maintained constant contact with the leadership at all of our utilities in our Birmingham metro area, and they have shared with me to share with the public that if you are a customer with one of these utilities and you've fallen on hard times, just reach out to them during this crisis, and I am more than confident that they will continue to work with you. I've also urged other housing providers to show grace to those who may have fallen on hard times during this crisis. We must show calm and compassion for everyone in our community at this time. My team has remained in close conversation with those who provide for our homeless population as well. Michelle Farley of One Roof will join us now to give an update on what we as a community are doing to address, assist, and support those who are homeless.
Good afternoon. The mayor and his office have been in constant contact with One Roof and some of our member agencies. We are very grateful for that participation. I want the public to understand that our emergency shelters are cooperating more than they normally do, and that's phenomenal. We have daily conference calls to update on how many clients are in shelters, if anybody has tested positive, even if anybody is running a fever. Our shelters are taking temperatures of everybody, some of them every hour on the hour, but at least when clients come in and out. We are also coordinating heavily with the federal government because HUD, Housing and Urban Development, is one of the major funders of homelessness services. We have been assured that they are working quickly to see that our agencies can spend money to stop this virus rather than to try to take care of people once they're sick. We are grateful for all of the nonprofits that are banding together to address gaps in services because the need, of course, is changing on a daily basis. So again, we are in constant contact with the CDC, the health department, the federal government, our city, and one another. Thank you.
Thank you, Michelle. The City of Birmingham has established a message system to update our residents with important and urgent information. Text in all caps BHM COVID. Again, in all caps, please text BHM COVID to 888-777 for updates. We also have a Spanish language service that's available for texting as well. Please text BHM COVID-19. Again, that's BHM COVID 19 to 888-777. And communication, we believe, is extremely vital during this time as we continue to communicate with each other and to you. And we're proud to be a proud partner of the Joint Information Center with EMA and other partners. At this time, Director Jim Coker will come forth and provide an update on our communications.
Thank you, Mayor. Good afternoon. I would like to point out that every speaker before me has illustrated how serious this event actually is. They also illustrate the level of cooperation and the level of communications that now exists between every partner, agency, city, and the county. The Joint Information Center was established this week to provide information to our citizens that is vital for their health. As the mayor stated, please use every avenue you can. Text in the keyword, follow the City of Birmingham on social media. We appreciate it very much, and thank you again.
Thank you, Jim. I want to speak to something that's really important. As we continue to monitor the COVID-19 in our community, we are also watching what's going on around the world. We pay a close attention to the country of Italy, and we find that their increase in deaths have been attributed to being one of the oldest populated countries in Europe. I want to remind people here at a local level in the city of Birmingham and in Jefferson County, we have our high share of seniors and elderly people in our community. And if nursing homes is the first line for the most populated area where a lot of our seniors come together, then the second place would be the church. Now, I am reminded that I am a man of faith, and I know this is hard times, and many of us are leaning on our faith. But I want to speak directly not only to the leaders of the faith community in Birmingham, but also want to speak to those who are members of these churches who want to continue to go. I had a conversation with pastors last week, and I spoke very directly to them, giving 3 options. Option 1 is not to have physical church at this time, that if the option was available to move church online, please exercise that. But if you had to have physical church, then please suggest, and now we highly suggest, that your seniors not attend church. The third option was, if people had to come to church, including our seniors, that you all could establish a protocol where people could be 6 feet apart from each other, that our elders and our seniors would not touch anything. In addition to that, not hug, not kiss, and not hold hands or shake hands. I know that is hard to do in these times because, as I stated earlier, leaning on our faith, we want to be close to each other. We want to be with each other. But as stated, if our seniors are the most vulnerable to the COVID-19, if those with underlying issues, who happen to be a lot of our seniors, are most susceptible to not only getting this, but making it harder for them to recover, then it is important for all of us, including our faith leaders, to urge our seniors at this time to stay home so they do not contract and get the COVID-19 coronavirus. At this time, I think it's important to also state this. Many of you all have been talking about and speaking to testing, access to more tests as well as more locations. I want you all to know that I've been in constant contact with the leadership at UAB Health Systems. I've been in constant contact with Dr. Wilson at the Department of Health for Jefferson County and many others in our health community. We are actively working on 2 things: making tests more readily available for residents, as well as working on additional sites. The second part, working on additional sites, is not easy. It requires a lot of bandwidth and manpower, and we hope to, at some point in the future, add an additional site. We also are aware that many people here in the Birmingham actual city limits don't have adequate transportation. It may be hard for them to actually get from point A to B, including testing. And so we continue to work to make sure we find an additional site for our Birmingham area on this side of the mountain. But I say that for this reason. I think it is extremely important, outside of social distancing, outside of good hygiene, that we continue to take care of each other and take care of our seniors. And at this time, I want to bring Dr. Mark Wilson up, who's the head of the Jefferson County Health Department, to also give an update as he's continuing to provide on a daily basis.
Hello, everyone. I'm Dr. Mark Wilson with the Jefferson County Department of Health. I've spoken to many people before about the seriousness of the COVID-19 outbreak. We are learning more every day about this. Even in the last few days, there have been new studies coming out looking back at other countries that have already been hit very hard by this. And we're finding out more and more about how contagious this virus is. It's extremely contagious. It's easily spread from person to person. It survives on surfaces for a long time, so that if you touch surfaces that other people have touched, you can get the virus that way. We also know that if we don't take early and drastic steps to help people in the population follow these social distancing rules and to also be very, very careful with hand sanitation, that we're going to really regret it later on with a major disaster on our hands. So we are rolling out more and more strict measures to try to limit the interactions that people have with one another as much as possible, while at the same time allowing people to get the essential needs that they have: food, medicines, health care, things that we need to go on with our lives. But I will tell you that it's going to be a difficult time ahead. Our job right now is to make sure we stop the spread of this virus as much as possible. I've been very, very heartened by the cooperation that we've all had with government officials, with our nonprofit community, with the emergency management agency, the hospitals, and many others. All these folks working together understand why it's important to work together and take action now, not only to control the spread of this virus, but to also support our community as much as possible during the difficult times we have ahead. So just like folks here have cooperated with each other, different agencies, mayors, county commissioners, etc., we ask for your individual cooperation. Each of us has a responsibility to care for ourselves and for our neighbor. Many, many people do get sick with this, but I will say that about 80% of folks do recover without major complications, but 15 to 20% of people that get this virus can end up with major complications, including hospitalization, respiratory failure, and unfortunately, some people die. We need to prevent that from happening. These are people we love. These are people in our community we care for. These are our grandparents, our parents, folks that we know who might have diabetes or lung disease. So we need to take care of ourselves. We need not to get the virus and spread it to others. And we need to especially do everything we can to protect those that are more vulnerable and prone to get into serious trouble with this. We also need to all do our part to help protect those essential services, those people on the front lines like first responders, our healthcare workers, our public health officials, the leaders you see in this room who are mounting a response to this. So we all need your help in that as well. We have to protect our healthcare system and our hospitals especially, so those healthcare workers are available to take care of us. So if we slow the spread of virus, we can slow the traffic that comes into our emergency rooms and fills up our intensive care units and beds so that the hospital will be able to manage this. So I really, really need everyone's cooperation. We really need to love our neighbor, care for one another, and do everything we can to prevent the spread of the virus and also just to look out for one another. You may have someone in your community who is vulnerable and has to stay home to avoid the spread. Offer to get groceries for someone. See what people need so that the elderly, those vulnerable, can stay at home but get their essential needs met. Thank you very much.
I want to thank you all for being patient with us as we gave a lot of detail today with a lot of people, a lot of community leaders, but we thought it was important to share and provide enough information, factual information, as well as what you can do and what we're doing on your behalf. One last note, for families with children, let's all continue to keep an eye on our children. Let's also make sure for those who are playing outside when they come in to continue to wash their hands as well. At this time, I'll bring Rick Journey up, who's the Director of Communication for the City of Birmingham, to assist us in answering and taking any questions from you all.
Mayor Woodfin, thank you very much. Once again, my name is Rick Journey. I serve as Director of Communications for the City of Birmingham. We have media on the line right now. I'm going to ask you that we are going to call you where you're not talking over each other, to stay muted, and then we will call per organization that's on the line, and you can ask your questions, and we will make way for those who are available who can come up to take your questions. So with that, I'll start off. I think the first one on the line was AL.com. If you have any questions.
Yes, thank you, Rick. I'm just curious, does anyone on city staff, the mayor, or anyone else know what the economic impact is going to be for workers in Birmingham? And I mean, how long could people potentially, hourly workers not have work, and what could that do to the city and to residents?
Okay, Dr. Josh Carpenter, Director of the Department of Innovation and Economic Opportunity, will come up and speak to that.
Birmingham has an economy that is unfortunately heavily concentrated in what economists would call the non-tradable sector. What that means is we depend on one another to buy and sell goods inside our community. So think about a coffee shop or a restaurant where someone from that community purchased a good that was produced inside that community. Tradable jobs are the things that we make here and sell in other communities. This is going to disproportionately hurt the non-tradable sector, and unfortunately, that's 71% of our jobs. So on the low end, we're looking at 14,000 hourly workers who in the next 24 to 72 hours are going to see work disappear. On the high end, I think the more likely end, it is closer to 64,000 people. We are working really hard to identify who those workers are, and if there are workers who are paying attention to this call, please know that your partners here at the public sector and in the private sector, as well as our corporations, are on calls daily to figure out how we can get you back to work as soon as possible. Just because the job you have today isn't going to be there doesn't mean that we don't have critical work that you can do now. As the economy shifts, so will opportunities, and so we're going to be with you, and to the extent possible, we're going to give you every tool we possibly can to make sure that you and your families are successful. Birmingham's not alone in this crisis, and I want to be mindful of that. Just yesterday, the Treasury Secretary in Washington said that unemployment could reach as high as 20%. Our goal is to take action with our state, federal, and local partners to mitigate the consequences of this disease on our families and our workers. We can't guarantee anything, but I am hopeful that given the speed and cooperation with the partners we have here, that we can stabilize our economy, and we're going to continue to work around the clock to make that happen.
Thank you, Josh. AL.com, is there a follow-up question before we go to our next caller?
Yeah, just going to mention stabilizing.
Anna, let's go first, Anna, and then we'll go to our next reporter. Go ahead, Anna.
I was just saying, you talked about stabilizing the economy. What would that look like, or do you know at this point?
So phase one is for us to start with small businesses. We're thinking about it in a three-part system. Obviously, some of it we can't control. The macroeconomics, the markets continue to fluctuate. Obviously, the big companies, the corporations in our community have seen their stock price tumble over the last several weeks. We're cognizant of what that does to wealth in our community. That's something that we can't control, so I'm not going to say that we can. The second piece is small businesses, and we know that's where the majority of jobs are in our community, so we started with an emergency loan fund. I want to be clear that it was just the start. I'm excited that Birmingham has been held up as one of the cities that's moving quickly to establish an emergency loan fund, and we have great partners at the Birmingham Business Resource Center who've done this before to help distribute funding as quickly as possible. But that has to be just phase one. We will have to do a phase two where we approach how this works for workers. And so that stimulus package could be really about how we think about this new labor market. So if we consider that our waiters, our baristas, our bartenders, the folks that work the counters at retail shops are now looking for work, we need to figure out how to repurpose them. And so we're going to try to figure out and flesh out what that scope looks like, but we don't have all the answers for that yet. But what I do want to double down on is that for anybody who is looking for work or whose income has been affected by this negatively, please go to behamstrong.com. The more data we have and the quicker we have it, the more capability we have at responding.
So we've got a good number of people on the call so that we can make sure everybody has an opportunity. I'm going to move on. We'll come back if we have the time to do additional follow-ups from various news organizations. WBRC, you're on the line. Do you have a question?
Yes, this is Morgan with WBRC. So the biggest chunk of this $15 million, 9.2 going to address the city's estimated budget shortfall. Can you tell me how you came up with that number, and what is the loss in sales tax? What's the greatest loss you expect to have?
I'll start with the second part of your question. A lot of our tax base is in the form of not only the business license in this hand from the actual small business owner, but in this hand it is the combination of sales tax, use tax, and occupational tax. And so we are expecting losses in those sales taxes, the occupational taxes from those hourly employees, as well as use tax. As it relates to the first part of that question related to the money that the council approved yesterday or last night, a lot of that is for public safety. Not only the addition of the equipment for our firefighters, rescue personnel, and officers, but the number of increased calls will mean more police and fire, particularly our fire and rescue services, will have to respond. That can mean more overtime. We also have to anticipate, because they could be possibly exposed based on the number of calls, if a unit is down or have to be quarantined, we'll have to have additional manpower or existing manpower to do more hours, which also leads to more overtime. And that's what that money is set aside for. In an ideal world, this doesn't last long, and we won't have to use all of that, but we need to be prepared for a minimum of the next 2 months around the type of response our fire and rescue would need to respond to the COVID-19.
Let me turn to WBMA. Is WBMA on the line? Do you have a question? WBMA, do you have a question on the line? Let's move to WIAT. WIAT, do you have a question?
Yes.
Go ahead.
My question is for Mayor Woodfin. Mayor Woodfin, are you considering implementing a curfew even if it's just for youth?
As many of you all know, the city of Birmingham 2 days ago declared a city state of an emergency. I think all things are on the table. I think we will have to entertain many things. I think this is very fluid, and as we continue to try to stave off and prevent the spread of the COVID-19, having a curfew is one of those things we're entertaining. That is not something we have exercised. That is not something we've had any full discussion about. But if we had to do that, I would come and share that with the public, and that would be in consultation with many others. But I think it's really, really important as it relates to our youth, that as it relates to family and community first, that the adults in the community are doing things to not only watch and protect their children, but make sure right decisions are made while children are idle and or out. The last thing we need or want is the city to have to come in with an enforcement end of this. But if need be, that is an option that is and can possibly be exercised.
Our next question, we are going to call on WVTM. WVTM, do you have a question at this time?
Yes, I have a question. This is Bria Douglas with WVTM. How is the city going to handle education as far as homeschooling after spring break?
I think the question, Dr. Herring is approaching, the question is how is the city going to handle education as far as homeschooling or anything else after spring break?
So thank you for the question relative to educating after spring break. To date, the district is closed beyond the spring break window. Spring break ends March 27th. We follow the directives of the state across the state of Alabama as it relates to when schools will open. We are constantly in communication and in touch. As it relates to homeschooling, I'm not sure if the question is, given that we are closed, everyone in their own way is homeschooling, or if you're referencing the homeschool population specifically. In either case, we're following guidelines as the state identifies and deems appropriate. As it relates to resources, we continue to make those available. Across Jefferson County, but in Birmingham City specifically, there are different approaches to how we are supporting instruction. As mentioned earlier, in Birmingham City schools, we are not doing e-learning, but we are providing educational enrichment resources, and that will vary given the immediate transition to close. At the same time, we'll continue to push out those resources and keep all of our stakeholders posted.
What about graduating seniors if school does not resume after spring break or before the end of the school year?
Okay, stand by. Dr. Herring.
So as the question relates to graduating seniors, members of the class of 2020, because we're currently in our closed state, we do not have a definitive plan yet, but it is important to note that a task force has also been formed at the state level, and as we continue to get information and guidance on that, we will keep the public informed. To date, we do not have a definitive response relative to graduation, but please note that it is on top of mind for all of us what the plan will look like for members of this year's graduating class from Birmingham City schools and from public schools across the state.
Okay, I'm going to move on to our next. Is Birmingham Times on the line? Would Birmingham Times like to ask a question at this time? Birmingham Times, would you like to ask a question at this time?
I don't have a question.
Thank you. Our next day is Summit Media on the line. Is Summit Media on the line? Okay, let's move on to WATV. Is WATV on the line? Do you have a question? Okay, I've received one question from What's Happening Birmingham. Jarvis, you're on the line right now. What's your question?
This question is from Mark Wilson. Will you extend the deadline for restaurants and bars past March 24th?
The question relates to will you extend the deadline for bars and restaurants past the date that you've announced?
We are actively looking at our options going forward on that. We had promised to let everyone know before that deadline. We're not quite at the point where we can comment on that. So I will tell you, though, that there's a team at the health department along with legal counsel and consultation between our partners to look at that particular question and decide where we go forward. We will let the public know as soon as we can to give restaurants enough notice to know what happens next. I will say that we are likely in for a pretty long haul with this outbreak. So that's going to definitely inform our decision. Thank you.
So I know, is there anybody on the line that we have not called on at this time? If you have not had a chance to ask a question, please ask your question now. Okay, I've got one more that's a text message for somebody who was having trouble getting on the line, and this goes to Chief Moon. Is the fire department having any trouble ordering PPE for Birmingham Fire and Rescue Service?
So as I stated earlier, we're currently auditing our PPE supply, and we're trying to stay ahead of the curve when it comes to the PPE needs, and that's why it was so vital for us to get the funding from the mayor and the council. There could be some lag time because we're competing with other agencies and other departments for certain PPE, but currently we're staying ahead of the curve when it comes to ordering PPE.
This is Sheila Smoot with Summit Media.
Yes, go ahead. Go ahead with your question.
Thank you, Rick. My question to the team, number one, Dr. Herring, if you can ask her. My question is about the homeschooling. What type of mechanisms are you sending out? Are you sending out a packet that will help the parents go through a curriculum, a very simple curriculum at home, or have you considered that? And secondly, on the feeding program, where can parents get a comprehensive list about the feeding program?
Okay, just one moment. Dr. Herring is making her way to the lectern.
So thank you, Sheila, for your question. At this time, we are not sending out hard copy tangible documents based on the current closure of schools. What we have continued to promote, and we will resubmit that as far as dissemination today, and we'll repeat that throughout this week, would be the following. Platforms that allow for parents to pull not just lesson plans, but instructional material to support students. There are a cohort of teachers in various schools, but because of equity, we're not pushing that out as a district, but teachers who have communicated as well. Our platform for communication outside of the district social media platform is also inclusive of our website, in addition to our district app that makes this information available. We are sensitive to the fact that there are those who may not have immediate access to devices and are aware of that, but at this time, that is the most efficient platform that we've been able to use. You also asked very specifically about the feeding centers and information, and as I spoke earlier, neighbors coming together to make sure that our families are nourished is a comprehensive effort across several school systems. Again, that's Jefferson County, Tarrant, Midfield, Bessemer, Fairfield, and Birmingham City Schools. You referenced the request for a comprehensive list. We will shoot that out as well electronically. We'll also take the time to send that out through emails. But as it relates to hard copy tangible documentation, our closure prohibits us to do that in packet form. So we'll push it through social media, and if it is helpful, for as much as the news outlets can be a resource, we'll utilize them as well. Thank you.
Did you have a follow-up? We're going to have time for two more questions. What's your follow-up question?
One for the mayor in regard to businesses. And my question for Mayor Woodfin is, does he see that we may be at a point where we will have to shut down everything? And if that happens, is he foreseeing the fact, or Dr. Wilson or the mayor can take this question, is he foreseeing the fact of how that would work in regard to enforcement of that rule?
Thank you for the question. As it relates to shutting down everything, I think it's important to start at a high level. The city of Birmingham, like many other mayors in the state of Alabama, like many other county commissions across the 67 counties, are following the advice of first our county health department, which for us in Jefferson County is Dr. Mark Wilson. He's been a trusted partner during this crisis. We value not only his leadership, but I think it's important to adhere not only to his recommendations, but he has enforcement powers through some of the statutory laws that have been created during an actual health crisis. Make no mistake, the city of Birmingham will not only follow, will not only adhere, but enforce anything that comes from the statutory power that the health department under the leadership of Mark Wilson says or dictates that this is where we need to move to. He has the influence over the entire county, not just Birmingham, but Birmingham will be in line with what our health experts and leaders at the health department share and recommend for us to do.
I believe, Roy, you were on the line with one more question. This will be our last question for this time.
Thank you, Rick. This is for Dr. Wilson, I believe. Would you address whether the suspension of gatherings
I lost you
for
for
people across the board affects public transit? And if so, what has been the communication with BJCTA and others? And if not, what recommendations do you have for the safety of drivers and passengers as they utilize public transit?
Oh, just one moment. Did you hear the whole thing?
Yeah, the question's about public transit. We were on a call earlier with Ms. Rivers of the Transit Authority and had some really strong assurances from them that they're taking every step to make sure that the buses are kept very, very clean in between rides, They're also encouraging people to follow our recommendations of social distancing to make sure that people don't sit near each other on the buses. So I was very pleased to hear of the steps they're taking. As we go forward, we're going to be making sure with our partners, the mayors and others, that the essential services that people need are going to be maintained as much as possible. And there are a lot of people that do have difficulty with transportation. So we're all working together to make sure those needs are met. But we have been in touch with transit to make sure that it's kept as safe as possible. Thank you.
I want to close us out by stating a couple things. One is, again, BeHamStrong.com. BeHamStrong.com allows those small business owners or any of those who have been affected by the COVID-19, this coronavirus, to share information with us. The more information you can share with us, the more data we can have that helps us not only provide it to us, but make better and wiser decisions on your behalf. Two is BHM COVID. Text in all caps BHM COVID to 888-777. By texting this, you allow us to communicate with you and provide you with the updates you need about what's happening. The other thing is Drew Langlow and the United Way. Many people want to help. Many people want to get involved. 211 still works, and if you are wanting to assist and or help, please take advantage of 211. One last thing. This is a health crisis, and this crisis requires not only leadership, but it requires compassion, and also requires constant communication. We will remain in contact with you. We want you to be safe, and we want those who are most vulnerable, for all of us to protect them. Let's do the right thing. Thank you.